Good morning and good afternoon, everyone. As you join, please drop your name in the chat. Introduce yourselves. Let us know where you're from and what organization you represent. It's good to see you here and look forward to our conversation. I see someone from Canada. Hi, Pam. We have the Tennessee Mental Health Consumers Association. Okay, now the chat's going faster than I can talk. Someone from Bellevue, Alan, just myself. I love it. Showing up as your authentic self. Bethel Housing in Jonesboro, Tennessee. Strong Accountable Care Community, Johnson City. Alethea Allen, Catholic Charities of West Tennessee, the Legal Aid Society of Middle Tennessee, and the Cumberland. It's good to see everyone. I know we have members of the NAACP here as well. Welcome. As you join, please continue to introduce yourself in the chat so that we can all see who we are working with to fight to protect Medicaid and SNAP. Elder Care Law of Tennessee, Agape Child and Family Services. Thank you for joining us today. Jake, thank you for showing up for the Medicaid and SNAP communities. We are excited to be here and to share information and also to hear from you about the impact, anticipated impact of Medicaid and SNAP in your communities. Raising Kellen podcast, good to see you. Paul Lacey, JMC, NAACP. The TARP Center for Independent Living. It's good to see everyone. As you join, continue to introduce yourself in the chat. Timothy Hughes, Nashville NAACP. Very good. I'm trying to see who else I've missed. I love the hearts. Let's get excited, you all. We've got work to do. Urban Child Institutes. Thank you for joining us, Gary. University of Tennessee Medical Center. Hello, Brooke. We have Barbara from UT Medical Center, Knoxville. Mike Hodge. It's good to see your name, Mike. Amber Shields. Kimberly Haynes. Nashville International Center for Empowerment. What I love about everyone introducing themselves in the chat is that we are able to see how many different organizations are impacted by the potential policy changes to Medicaid and SNAP. Second Harvest Food Bank, Studio Apartments Knoxville, the service coordinator. That is real. All of us are coming together from our own sectors to fight to protect Medicaid and SNAP. Now it's 11:30. For those that are new, please continue to introduce yourself in the chat. We're going to go ahead and get started. First slide, Reed, please. First, I want to say thank you to our comms team up front. Reed and Danelle have been doing a fantastic job with making sure that we are able to bring this briefing to you all every week for the last few months. So thank you, Reed. So this briefing will be recorded. Everyone will receive slides at the end of the call. The slides that you're going to receive are going to be more detailed than what you will see during the presentation, but you will have those emailed to you along with this recording so you can refer back to it and share it with others that were not able to be here. Continue introducing yourself, please. Next slide. We have today, again, we have Gordon Bodeman, our staff attorney, and also Signe Anderson, who's the Director of Nutrition Advocacy. We are going to have time for questions and answers. So we're going to make sure that we're able to answer as many questions as we can. But let me say this, we know what's been going on in the last 24 hours. And so our foot is to the pedal. And so with regards to our advocacy efforts, so we'll answer as many questions as possible. Before I hand it over to Gordon, I want everyone to type the word fight in the chat because we are here. We are not backing down. This is a fight to protect Medicaid and SNAP. So everyone type the word fight. I am not immune to this. Type the word fight in the chat. And Gordon, I'm going to hand it over to you to give us an update of sort of what's going on with the budget reconciliation process.
Thanks, Tanae, and thanks everybody who's joined us over these recent weeks and is joining us today. Just a quick recap for people who may be new or who, unlike me, have had better lives than spending all of their waking hours doom scrolling as I've been doing during this recent drama. So the Congress has put together so-called One Big Beautiful Bill, which is almost the entirety of President Trump's domestic agenda. It's a lot of his foreign policy agenda as well, all in one bill. And it's going through the budget reconciliation process, which is a special procedural device that enables the Senate to enact it without subjecting it to a filibuster, which would normally require 60 vote majority rather than a simple majority of 51 votes. That process has all sorts of intricate moving parts to it and arcane rules. The short version of what's happened is that that bill is been moving really since January. Early on, the president set July 4th as the deadline for passing it. And there have been all sorts of dramas in both the House and the Senate. As it has moved forward, it looked like it was held up. It looked like it might die. It looked like it would fall apart. And each time the president has come in, pushed the members of the House and the Senate, they've fallen into line and it has moved forward. And we are now on the eve of it finally being sent to the president by Friday, but it's not over. So, and this has been a squeaker the whole way. It passed by one vote, 215 to 214 in the House in May. Then yesterday it passed with Vice President Vance casting the vote. It was 50 to 50 in the Senate with all members voting. And under the Constitution, in that situation, the Vice President cast the tie-breaking vote. And of course, he voted for the bill. So it's been hard fought. It was expected to fly early on, and I think the fact that it has been so tough to get passed is a reflection of how much folks on this call and really across the country have been raising concerns. It really, as I said, it encompasses a lot of things, but the core pieces are extension of tax cuts and the expansion of tax cuts, and then to offset that lost revenue, huge cuts, unprecedented cuts to the safety net, specifically, not exclusively, but overwhelmingly, that money is coming out of Medicaid and SNAP. And so that's the backdrop for all this. Where are we now? Well, as we speak, Speaker Mike Johnson in the House is getting ready to seek a floor vote to accept the Senate version. And if they accept the Senate version without, in the House, without any changes, it immediately goes to the president for his signature. On the other hand, if they say and there are various factions in the House that are unhappy with the Senate changes, that they want to amend the Senate version, then it would go to a conference committee, and that could take weeks to resolve their differences, although it probably would move relatively quickly only because the president is lighting a fire under everyone. You've got budget hawks on the far right that are demanding deeper cuts, that are deeply distressed by the fact that this will add by $3.8 trillion to the national debt. You've got more moderate members from swing districts that are concerned that they will be defeated for reelection if these cuts primarily to Medicaid go through impacting people in their districts. So that's next slide, please. That's really sort of where we've gotten to at this point. We don't know whether it'll come to a vote this afternoon as intended, or whether there will be delays. Just want to emphasize that you've got these factions and they're pulling in different directions. And we will come back to the details of where we are, but I'll turn it back to Tanae at this point.
Thank you, Gordon, for that overview. And if any of you all are like me and my household, we have been tuned in as well to what's going on, but it's really helpful to have a high-level overview synopsis for those of us that don't have a chance to get into the weeds. We are going to turn it over to Signe in just a moment to discuss about SNAP. But before we do that, let's welcome Signe by again making sure that we keep the energy high. In the chat, I want you to say protect SNAP. Everyone say protect SNAP. This is a fight. We know that this is hard work and that all of us are doing our due diligence, but we are not going to lose hope. We are going to continue to stay the course. Signe, I'd like to invite you to come on up and take the wheel for the next slide. Signe, are you there? All right. Gordon, I'm going to come back to you right now. And just to keep it moving, I want everyone to say protect Medicaid, because we're going to ask Gordon to come in back and give us the details about what the impact is to the proposed policy changes for the mega bill that's being discussed. Gordon?
Okay. You've probably seen different estimates of the impact from cuts to both Medicaid and coverage under the Affordable Care Act, the so-called insurance marketplace. And the reason why they're conflicting is because you're dealing with a House version. There were preliminary estimates by the Congressional Budget Office, the neutral, nonpartisan staff in the Congress that comes up with budget estimates and estimates of losses of coverage. And then they had preliminary estimates, that they had final estimates, then they had the Senate version. We don't have a final estimate of impacts in the Senate. It's telling that they only reveal the final language and out of this 887-page document that they voted on 1 hour after they saw the final text. And so that's kind of reflective of the way this thing is being jammed through. And the reason why it's being jammed through is because it's really not popular. And the more people learn about it, the less popular it becomes. And recent polling shows that a majority of Democrats, as you would expect, but also a substantial majority of non-MAGA Republicans and independents don't like the bill, primarily because of the cuts that it makes and what it adds to the national deficit. But even MAGA supporters of the president, when they learn more about the bill, they become disenchanted as well. And it's for that reason that there's this pressure to get it through quickly before people figure out what is about to happen. And that's the reason why you see conflicting numbers, is it's moving faster than the experts can analyze it to say what the impact will be. But to give you a sense of the order of magnitude of what we're facing, we're looking at CBO estimates, Congressional Budget Office estimates, of cuts that would be around $1 trillion. And when you add in the state, it's a matching program. So those missing federal dollars are likely to be accompanied by a reduction in state funds totaling around 1.3 trillion with the T over 10 years. That converts into, according to CBO, the House version would have cost 11 million people their coverage, 7.8 of those would be on losing Medicaid coverage, 3.2 would lose their coverage as a result of the failure to extend expiring premium tax credits that will for the purchase of coverage on the marketplace. That's the House version. Preliminary estimates are that the Senate version would cost 16 million people their coverage. The thing to remember, we're talking a lot about Medicaid, but the Affordable Care Act has played a really important role in moving us towards universal coverage. And sadly, this achieves the long deferred dream of the president and the Republican majority to repeal the Affordable Care Act. You'll remember that in 8 years ago, there was a similar effort to repeal the Affordable Care Act or Obamacare, and it was defeated by one vote when Senator McCain in the Senate voted against it. Now, instead of frontal assault that says repeal it, the effort is to inflict death by 1,000 cuts. And so it's going to become more expensive and unaffordable, provide less coverage, and be difficult administratively for people to navigate. Next slide, please. Just a quick transition from the national to the state picture. Medicaid, or TennCare as we call it, covers 1.4 plus million Tennesseans. That includes half of all Tennessee children, including most with special health care needs. It includes a lot of small business owners. 24% were getting food assistance through SNAP or health insurance through Medicaid or CHIP at some point in 2023. And health insurance is particularly problematic for small businesses because of the rate at which health insurance inflates, along with health costs. Typically, health inflation has outstripped the general rate of growth of the economy for over 60 years, and there's no sign of that abating. So that's why it's really important to groups like small businesses. We hear a lot of talk about appreciating our veterans and their service, but it's ignored that those pledges of gratitude to veterans are ignored at a moment like this when we overlook the fact that 22% of veterans have received food assistance or SNAP through these programs that are now on the chopping block. 27% of TennCare enrollees live in rural communities. It's a primary source of funding for the rural healthcare infrastructure, and 9% of veterans in Tennessee are covered by Medicare. And as I think I mentioned earlier, 60% of people in nursing homes. So it is a lot of people and a lot of people who Congress purports to care about, but in a moment like this, you have to wonder if they realize what it is that they're about to do. Next slide, please. The University of North Carolina at Chapel Hill Shep Center, which is recognized as the National Research and Data Center on Rural Health Delivery in the United States, has put out a list that they sent to congressional leaders and the president, identifying 700 hospitals nationwide, including these 9 hospitals in Tennessee, that based on their current financial situation, if they lost significant Medicaid funding as threatened by this bill, they would likely close. I might point out that in addition to these, there's also the threat that hospitals that might stay open would respond to the loss of funds by cutting services. So to cite an important example, there are hospitals across rural Tennessee that no longer provide OB services. And we have the highest maternal death rate in the country. And this is no time to be cutting back or threatening the delivery of maternal health care services as this bill would do. Next slide, please. Um, I just want to emphasize, as the last slide did by implication, that it's not just TennCare enrollees who will feel these Medicaid cuts, that you also have the general community that relies upon a healthcare infrastructure that is very importantly reliant on Medicaid funds in numerous ways. So you don't have to be on TennCare with your services affected by the Medicaid cuts in order to feel the impact of this. And one example that has gotten almost no attention that really concerns me is the elimination of minimum staffing standards for nursing homes. The great majority of nursing homes participate in the Medicaid program. Medicaid is the largest purchaser of nursing home care in the state. Again, nearly 2/3 of nursing home residents rely on Medicaid. And if a facility accepts Medicaid funding, it would be subject to minimum staffing standards that protect everybody in the facility, whether they are receiving TennCare themselves or not. It attaches to the facility. This bill will do away with minimum staffing standards, affecting the health and safety of everyone in the facility, including those who pay privately. And I would just say to members of our congressional delegation who are voting for this, if you think it's okay for your mother or other loved one to be in a nursing home and to be in pain or have a crisis and press a call button in the middle of the night and there's no staff there to respond, then fine, go ahead and eliminate these staffing standards. Because we know what, from long experience, what the effects of that are on people. But if you do care, then please change this bill. Do not eliminate these standards. They will affect lots of people. And then, as the slide points out, just want to note that a hospital is a lot more than a hospital. It's the hub of local healthcare. It's typically one of the largest communities, one of the community's largest employers. If you lose the hospital, doctors, nurses, other clinicians move away, and it's difficult to recruit new ones if there's no hospital there. Nursing homes, pharmacies, and clinics find it difficult to retain their financial viability and remain staffed. Again, those are the effects of when hospitals close, and we've seen that sad story play out all too often in Tennessee already over the past 15 years since we've refused to expand Medicaid. So we're already at a disadvantage in this state, and this bill will make it much worse. We have significant areas, particularly in West Tennessee and East Tennessee on the Cumberland Plateau, that are current hospital and healthcare deserts because of hospital closures. And then communities that lose their hospital and then the knock-on effects of losing other health services find it's very difficult to expand and certainly to attract new businesses and employers there. So you're really having an enormous impact on the economic viability of a community. And what we hear from clients and local officials in communities that have lost their hospitals is that their ambulance, their EMS is really strained because the ambulance services has to drive farther to take patients to receive emergency care. And when that happens, they're out of the county. And so new people call in with 911 emergencies, and they have to wait for a long time until the ambulance gets back to respond to their emergency. So there are all these effects, whether you are reliant on TennCare yourself or not, or whether you even usually go to the hospital. Even if you don't use the hospital, having it there has an enormous makes an enormous difference. So with that, I'm going to pass it back to Tanae.
Thank you, Gordon. Everyone, I just dropped in the chat, and I dropped it in the chat earlier. I believe we have some individuals from the media that might be on this call. And thank you for being here. But we ask that if you are media, if you have questions, that you join us at 12:30 for the media only call, because we have set aside time specific to the types of questions you have. For the stakeholders on the call, I want everyone to drop in the chat your why for protecting Medicaid. I'm going to do the same, but before we turn it over to Signe in just a moment, everyone drop into the chat your why for why you are here and protecting Medicaid. Signe, I'm going to turn it over to you.
Hi, everyone. Thank you for being here, and thank you, everyone, for your messages to protect SNAP and to protect Medicaid. It's great to be here with you, fighting this fight. I have some updates on SNAP. Yesterday, the version that the U.S. Senate passed represents the largest and worst cuts to SNAP in U.S. history. There are a lot of similarities to the House version that passed, but in both represent really, really significant changes that will have negative impacts to Tennesseans. Over 40 million people nationwide receive SNAP, and everyone will feel the impact in some way. Including 16 million children who are at risk of being cut from the program, 8 million seniors across the country, and 4 million people with disabilities in the category of non-seniors. So many people will feel this. The bill slashes an estimated $186 billion from the SNAP program, according to the Congressional Budget Office. And just a reminder of who participates in Tennessee, specifically on the next slide. More than 2/3 of those receiving SNAP in Tennessee are children, seniors, or people living with disabilities. In 2024, over 700,000 Tennesseans participated in SNAP. At the end of the Great Recession, we had nearly 1 million people, 1 million Tennesseans participating in the SNAP program. 66% of families with children participate in SNAP, 37% are older adults or individuals with disabilities, and 33% are working families. These cuts will reduce access to critical resources that millions of families rely on to survive. The bill will drive millions of families deeper into poverty and in poor health. And I just want to hone in on the folks that we know will be cut, will feel the brunt of these cuts if this moves through the House. It's our seniors, our veterans, children, houseless individuals, and working families will feel the impact of this the most. The bill will raise costs and reduce food assistance for millions of people by cutting federal funding for SNAP. And on the next slide, I'm just going to get into the details of the Senate version breakdown. We've been through this, but there were some changes that happened in the last couple of weeks, and so this just gives you a sense of where we are now with the breakdown. It fundamentally alters the program by shifting hundreds of millions in costs that have always been covered by federal dollars, and it shifts it to states like Tennessee. The federal government has always paid 100% of the cost share of the benefit, guaranteeing that Americans would have access to critical food assistance during times of individual crisis, economic downturn, natural disasters. We know in Tennessee we face natural disasters regularly, and that's what SNAP is here for, is to help during those times. So the cost share piece, the Senate bill requires that states with SNAP error rates above 6% pay between 5 and 15% of food benefit costs. In 2024, I know I've shared this statistic in our past calls, but in 2024, eligible Tennesseans received $1.62 billion in SNAP benefits. So those dollars came to us from federal dollars, from from the feds. And for Tennesseans, that would mean as much as $243 million in new costs for the state. So that's a new cost that the state will have to find and have to come up with. And making states pay for this cost really undermines SNAP's ability to respond to economic downturns and natural disasters precisely when families need the help most, and quite frankly, when states' resources are most depleted and the states need these resources the most. If the states decide they can't afford the program, we are likely to see severe cuts to participation. They will have to decide who does and who doesn't receive these benefits, even when people are in need of them and are eligible otherwise, or they could decide not to operate the program entirely. And going back to the first bullet, work requirements, the bill subjects more seniors up to age 65 and parents with children as young as 14 who will experience the possibility of being kicked off the program. And this happens when families cannot document 20 hours per week of work. And raising a family does not count as work. And as a mom, I can tell you that raising a family is work. But under this Congress, they do not count that, and they're looping families into this work requirement piece. And under current rules, most people who it excludes elderly individuals and people with disabilities and people with children. And already the current existence of the work requirement does not work and is not working in the way that it is intended to. The majority of people who can work do work. So many working Tennesseans are already cut from the SNAP program because of current rules, and we see these individuals in the casework that we do. People who either can't find enough hours or just can't process the paperwork that the state needs in order to do this. This is death by 1,000 paper cuts is what this work requirement piece is. And really, truly, the work requirement piece, it takes basic needs away from struggling low-income families at a time when we should really be providing support. It's an incredible administrative burden and extremely costly. And research shows that work requirements do not increase the rate of employment. It instead just kicks people off the SNAP program. So those are those first two pieces are really significant cuts. The administrative cost burden is also an increase. There will be millions of dollars more that the state has to produce in order to pay for the administrative cost of the program. And then the Senate version also eliminates legal immigrants from SNAP, which is a very narrow part of the population that participates in SNAP, but it's important. It's an important group that currently receives benefits. In this version, ends SNAP support for refugees, asylees, victims of labor, sex trafficking, which have always received bipartisan support in the past. And then on the last slide, it shares just a few more areas where the Senate version is going to cut SNAP benefits, SNAP Ed programs we've mentioned before, and also eliminating the Thrifty Food Plan is the last piece. The current benefit amount is extremely modest. It offers just $6 a day per person, but still plays an incredible role in fighting hunger, and that benefit will remain stagnant under this current rule. And so lastly, I wanted to also just drill down the impact beyond individuals who are impacted. The indirect impact of the SNAP cuts will hurt our communities and businesses across the state. It has an extreme burden on schools who are trying to feed hungry kids. Our rural communities will face significant burdens. There's more demand on food banks, which we've talked about in past calls, and just reducing the overall economic activity for grocers and small businesses. This bill really significantly impacts food insecurity and makes health outcomes worse. And so we are continuing to fight the fight until the bitter end. And even at the end, we will continue fighting, because there will be more work to be done. No matter what comes out of this, we will be here, and there will be work to do to address all that we've been through over the last few months.
Thank you, Signe. Everyone, thank you for sharing your whys in the chat, whys for Medicaid and whys for SNAP protection. This is a fight that we have been levying for months now, and we're not going to back down. So we've got the energy. It's about running a marathon, not a sprint. And so we are going to keep on keeping on. Again, for those that are media, we do have a session coming up for media only, coming up at 12:30. So please make sure that you register for that. We do have questions that were submitted through the registration form, as well as questions that we are receiving here in real time. So I'm going to try to address as many questions as we can. The first one, Gordon, is coming to you. I'm wondering if you could just share and talk a little bit about the timelines for which provisions go into place and how they align with election cycles. This is a marathon, not a sprint, so we are looking at the long game. Provisions that go into place, the timeline, and how they align for election cycles. Gordon?
Yeah, there's a sort of political context to all of this. One reason why there's such a rush to get this through is, as I mentioned earlier, the longer it hangs out there and people learn about it, the less happy they become with it. And there's a real pressure to get these cuts done now, because next year are midterm elections, and all of the members of the House of Representatives and a third of U.S. senators are up for election in November. What is that now? 15 or 16 months from now. And it's difficult to pass this controversial bill in an election year. The hope is that they can push it through this year, and people will have forgotten by the time they go to the polls next year. One, to not remind people before they go to the polls of what's been done to them. Many of these provisions don't take effect until after the November of 2026 elections. Some of them are phased in right away, and some are not phased in for 2 or 3 years. Much of that a political calculation, and there was a lot of horse trading at the last minute in the Senate. Special deals made, for example, for Alaska, because the senator from Alaska was withholding her vote. And so we're still trying to sort all of that out. We will be able to tell people this time next week. Hopefully we'll have CBO estimates and we'll know more about the details. I just want to emphasize it is not over. They are struggling right now. The House Freedom Caucus, which is on the right and wants to make deeper cuts, is written an angry 3-page critique of the Senate bill. It could be that they end up, and Representative Ogles, that represents part of Nashville and Middle Tennessee, is one of those members of that caucus. Not usually a friend of SNAP and Medicaid, but is demanding deeper cuts. It could be that the result will be that deeper cuts will be made before the House adopts this legislation, or it could be that they won't be able to agree and they'll have to take more time. And again, the more time, the better. But next week, we will be able to give you more information about effective dates and details. Right now, that's pretty much up in the air. But as I was saying, a lot of the effective dates are being adjusted with a view towards election cycle.
Thank you, Gordon. I'm staying with you for now. So you talked about hospital closures, but I believe that understanding the impact to hospital closures nationwide is probably the best strategy in order to get people to understand, or elected officials to understand the impact. So bear with me, I'm trying to merge a couple of questions here. So the first part of our question, can you help us understand sort of high level, how many people we anticipate losing insurance in Tennessee alone that's connected to hospital closures? Because if they don't have insurance, then that's going to offset the revenues for hospitals, right? So one, how many people in Tennessee? And then how many rural hospitals closed because we didn't expand Medicaid in the past? And what's going to happen? Reiterate what's going to happen if more hospitals close. So 3 parts to that question.
Let me take the last one first, because the the number, I don't remember the number off the top of my head, but the Shep Center at University of North Carolina has tracked, there have been something like 10 or 12 hospitals closed over the past 10 years. And those are particularly concentrated in rural West Tennessee and in East Tennessee, particularly the Upper Cumberland area. And that's largely a function of our refusal to expand Medicaid. There's been a lot of research that shows that failure to expand Medicaid makes it 6 times more likely that hospitals in a state will close, and that's certainly been borne out here. Can you refresh my memory about the other 2 parts of the question? You're mute.
Thank you. 5 years in, and I still mute myself. You already mentioned the number. You didn't have that off the top of your head.
Oh, the number
of individuals that will,
yeah.
if these Medicaid cuts go through, how many people will be left uninsured in the state of Tennessee?
Okay, so again, moving target given the changes in the Senate, but the original preliminary Congressional Budget Office estimates were that 77,000 Tennesseans would lose coverage from changes to Medicaid and the Affordable Care Act. But they estimated also that that number would rise to 250,000 if enhanced premium tax credits to purchase ACA insurance expire at the end of this year without being extended. And there's no talk in either house of the Congress of extending those. So we're working with, in the absence of more precise and current numbers, around 250,000 Tennesseans. What was the other?
I think you got it. So
Okay.
you got it. I'm coming back to you in a moment, but Signe, with the anticipated cuts, and I'm asking you this both in Medicaid, when we think of rural hospital closures, people losing insurance, and also with SNAP benefits, people losing their ability to have access to the most basic, just getting the caloric intake that they need, fruits and vegetables, just simple apples. We're not talking about organic, just basic food security. How do communities pivot with these cuts? How do we then support those that are still going to need these resources with the hospital closures, with not having access to healthy foods or food in general?
Yeah, it often falls on our food banks and pantries, and one food bank meal is equal to nine SNAP meals. And our food bank friends have shared that they are not going to be able to meet this need. Food banks have also seen cuts at this time to their budgets, to the food that they're able to provide people. So Congress is really doing a disservice to anybody who's struggling with hunger by creating major cuts to the safety net programs as well as food banks. So it will be extremely challenging to meet the need if all of this goes through.
Thank you, Signe. A couple of comments that have come through that I wanted to lift up to everyone. I am a mother of a 25-year-old multiple disabled son. He has SSI and ECF choices. He's currently in CLC housing. The big beautiful bill causes me great concern about his future. Lots of acronyms there, but just know that this is a mother that is concerned about the impact of Medicaid cuts to her 25-year-old differently abled son. Also, we have another comment that says, my grandson is a kidney transplant recipient before the age of 2 years old. He and his parents depend daily on the support they receive from Medicaid. Gordon, will this current version of this bill affect his benefits? And I know you don't know his case specifically, but give us a high level understanding about what they can take away from in the upcoming months and upcoming years with these potential cuts.
Thanks, Danae. And, all I can say to those parents and grandparents is, I'm just so sorry that we are adding to your stress by sharing this information, but that's where we are. I just have such great admiration for families that are so dedicated. What we hear in terms of talking points in support of this is we are protecting Medicaid. The president promised that Congress would not touch Medicaid, and the neutral Congressional Budget Office is saying most recently that 16 million people will lose their coverage. And so what do we hear to try to mask that? Well, the answer is this will not affect children. This will not affect people with disabilities. This will not affect seniors. You cannot take $1.3 trillion out of the program without it affecting everybody in some way. So we can't know at this point exactly how it will impact particular groups or particular providers. I mean, I've seen questions, for example, what about the impact on community mental health centers? We don't know. The way this will primarily affect Tennessee, if the Senate version passes, and I won't get into the details of funding, but the range of cuts, it ranges upwards and approaching $2 billion when you put together the SNAP cuts and the Medicaid cuts. That's annually. So that's enormous. It could be substantially less than that. The main way these cuts are going to be felt is through bureaucratic red tape. They increase the number of certifications and what is required to hang on to coverage. And we at the Tennessee Justice Center know as well as anyone in this country how lethal paperwork can be. We spent 5 years in litigation over TennCare's flawed system for determining eligibility. If you've ever spent hours on hold with the call center or dealt with waiting lines at IRS or Social Security, and let me just say that's a walk in the park compared to what TennCare has been. And we know that if you make it difficult for people to get through that with endless reporting, submission of documents that are lost by the bureaucracy, and then you have to resubmit, et cetera, that's a very effective way of cutting people off. And to give you some concrete numbers, last year, TennCare at the end of the COVID moratorium did a review of the eligibility of everybody on the program. Upwards of 500,000 people lost their coverage over the course of about 12 or 15 months. And of that, 75% lost their coverage, not because they were found to be ineligible, but because of failure or inability to complete the paperwork. Sometimes it was too much for them due to disabilities, or they're working, they can't get their employer to submit verifications, et cetera, et cetera, et cetera. Sometimes it was because they were sick, they could not wait 2 hours on the call at the call center. And sometimes it was because they kept reporting things and submitting the documents only to have them lost by TennCare. So That's a damning statistic when you consider that only 25% lost it because they were found to be ineligible. The rest just got worn down or kicked out for administrative reasons. So that affects everybody. That affects children, affects the elderly. So this argument that, oh, we're not going to affect any of those people, we can't guarantee that anybody will be safe in this scenario.
We can't guarantee that anybody will be safe in this scenario. I think that is the reality, that those are the facts. We can't guarantee that anyone will be safe in this scenario. And we can guarantee that we will continue to share accurate information about the impact to these proposed policy changes that are being considered right now in Washington, D.C. We have a question from Karen McIntyre. She is with the NAACP in Upper Cumberland, I believe. And Karen's question is about how do we get the word out? We know that media is, spread thin, covering different stories, but we have known these details for months now. For years, we've known the impact of the Medicaid policies and SNAP policies as being foundational to the livelihood of residents of Tennessee across the country. How do we get the word out to make sure that people are accurately informed about the potential changes? Signy, I'm coming to you. I'm asking not only about the general public, lay individuals, but also what is the best way for us to accurately convey the impact, the trade-offs to our elected officials?
Yeah, we've talked about this, but sharing stories, like if you work with clients, you share what it is like to work with your clients. If you have a story of trying to connect to the benefits, that's the way to lift this up and to bring it home, is to explain what the practical outcome is of doing this to families. Sharing the stories are really, really important. And speaking out, just even if you've talked to them once before, twice before, keep those calls going, keep talking. And also not just your elected officials. I talk to your neighbors, talk to your families, because I think there's a lot of misinformation out there, and the more information that we can share with people that are not informed, the better we're able to protect these programs now and in the future.
Signy, last week I heard, and forgive me, I cannot quote the exact number, but I heard from our national partners that the majority of individuals, if they knew about the cuts to Medicaid and SNAP, would be 100% opposed, but they don't have that information. And so what you said about telling our neighbors, telling our friends, folks that we worship with, our elected officials, tell them your why. That's the story piece, right? And also let them know the trade-off. If more people had access to this information, we believe that they would also be screaming from the rooftops, say no to cuts to Medicaid and SNAP. Gordon, talk to us about the impact to potential individuals with private insurance. So those that, like myself, that might have Blue Cross Blue Shield up Tennessee, cuts to Medicaid. How do we talk about it in with communities, individuals that may not touch the Medicaid community? What is the trade-off? How will everyone's access to healthcare or affordability of healthcare be impacted?
Tonight, think of the healthcare system and all of its parts, from the local Walgreens to the hospital neonatal intensive unit to the nursing home. Think of that system that we all interact with in one way or another at various points in our lives or through our loved ones as a big pie, and you divide up the slices that of funding that goes into funding it, to sustaining it. And Medicaid has been a significant slice of that pie, more for some sectors like nursing homes than others. like pharmacies, but still a very large piece of the pie. And suddenly the federal government is coming along and taking a big chunk out of that contribution. What does that, how does that system react? Either it cuts services, which again, it doesn't make any difference what your source of coverage is. If that provider is no longer there, or that service, that OB service in your rural hospital is not there, it doesn't make any difference whether you're insured or not. You're not going to be able to access it. That's one reaction. The other reaction is that the system then tries to make up that money from the other contributors, which means that they're going to charge more, try to negotiate higher prices with Blue Cross Blue Shield to try to make up the difference. And Blue Cross Blue Shield will then pass on those costs to you in the premiums. It's just like, you know, think of this as a community effort that all we're all putting money into the pot to sustain this public resource, which is our healthcare system. A major funding is pulling back. That leaves the rest of us having to make up the difference. We will see that in higher costs.
Thank you. Let me ask you this. You know, all hands are on deck. We are spreading the word. We are engaging with partners on the call and those that were not able to make this call. Gordon, what do you know about hospitals, the Tennessee Hospital Association, other entities that will be impacted directly by these cuts? What do you know about them lifting up their voice in protection of Medicaid and SNAP? Because we know that nutrition is connected to health. If you're going through if you have a medical condition, let's say you have cancer, you've got to get that nutrition, or you're not going to be able to fight that disease, right? So what are we hearing from the Tennessee Hospital Association, hospitals in general? Are they lifting up their voice? If not, why aren't we hearing about it?
I think those groups are nationally, I can't speak for the Tennessee Hospital Association, nationally, the organizations, the national hospital industry has been speaking out and running ads. Mr. Alan Levine, who is the CEO of Ballot Health in Upper East Tennessee, has gone public. I think a lot of the hospital lobbying has been quietly in the background for fear of antagonizing the president. Mr. Levine, who I know slightly, has been interviewed. He had an opinion piece in the Tennessean here yesterday, and he was interviewed on local television in Johnson City a week or two ago. Very outspoken on this, and it's important to recognize that he is a very conservative Republican who ran Medicaid programs in the states of Florida and Louisiana under conservative Republican governors. And he is saying this will cost 1,000 jobs in our community, and it will cost our ability to take care of people. So he has been speaking out. I know that there's been intense lobbying behind the scenes. But he's the one person I'm aware of who has spoken publicly and I think courageously. And it's important, again, to note his conservative Republican background.
Thank you. We have a few more questions, but time is getting away from us. I'm not able to, it's going to be hard for us to answer the individual specific questions, but just know that we are continuing to hear from you about the specifics of your details, of your families, of your loved ones, about the potential impact. We know all hands are on deck. What do we need to do, Signe? This is 12:26 p.m. on a Wednesday. We know that there is a charge for this policy to be on the desk for the president before this mega bill to be on the desk of the president before the 4th of July weekend. What do we need to do?
I would say still contact your house. I mean, the house, if anything falls through, if things don't move forward, there's still room to voice what you feel about this bill. So I think it's worth doing that. I think also just continue to stay informed. Follow us. We will give you updates, and if there are other ways to weigh in, we will definitely lift that up. If you're active on social media, do that too. There are lots of ways to stay engaged.
Thank you. We have a comment from Tony Garr that I wanted to lift up in the chat. No healthcare is free. Someone somewhere will pay for it. I invite you to read the rest of it for the sake of time. I'm not going to do that. Gordon, this is the 9th hour. From your perspective, what do we need to do? And while Gordon is answering, I want to know from you all on the call, what do you intend to do? At 12:31, when you get off this call, what do you intend to do to move to action to help protect Medicaid and SNAP? Gordon, you're on.
Thanks, Tanae. I think the items in the slide are it. We just need to get other people to be calling our local representatives. They just need to know this is very unpopular, and it doesn't make any difference whether it's because it adds to the deficit or it cuts Medicaid or SNAP. They are counting those calls, and they need to hear your call. And I just want to, as I say, I'm doom scrolling throughout this, just a bulletin from Politico just reported that the Freedom Caucus, again, they're on the other side of this issue from us. They want to cut more deeply. But they are pushing back on this, and it may upset the July 4th deadline. The senators have all gone home. So if they don't pass, if the House doesn't adopt the Senate version, they're not going to be able to go to conference until after the holidays. And if we can get past July 4th, then I think and require Congress to take the time to do this right, there's a chance that we can literally save a lot of lives.
These cuts will impact individuals' access to the most basic needs: access to healthcare, access to nutrition. It will impact community health centers, federally qualified health centers, our hospitals, whether or not you're in Nashville and you're seeking care at Vanderbilt, or you're in a rural community seeking care. It will affect all of us and change life as we know it. The stakes are that high. Thank you for joining us. On the screen, you'll see. Go back one more, Reed. Thank you, to the 1-800 number. Call your representatives, share your stories. If you are so moved, please draft an op-ed. But regardless, we have to share information. That is the only way that we are going to be able to get the facts out. Thank you for joining us today. Please look out, and for those who have registered, you will receive the slides. You will receive the recording later on today. We will keep you updated as we learn more information, and we will see you next week at this time. For those that are on media, we'll see you on the other call at about 12:30, 12:31. Thank you, everyone. Have a good day, and stay encouraged and stay in the fight.